Hi, everyone. Welcome. Welcome to the webinar. This webinar is called The Informed Advantage, Combating Rising Premiums with Claims Data and AI. We're really excited that you're here. If you've made it this far, you're joining us for the next 30 minutes to talk about how both of these technologies, both claims data and AI, can make a huge difference for clients with this next year. Amid rising premiums, it's more important than ever that we're working hard for our clients to find solutions to help them save. I'm your moderator, Amanda Meadis from TPA Stream. Today, I'm joined by Jacob Sheridan, co-founder and CEO of TPA Stream, and also Derek Rine, CEO of Trifecta Benefit Solutions. If you have any questions today throughout the webinar, you can drop them in the question box, and we'll make sure to get those answered either during the session today or via follow-up email. With that, let's go ahead and get started. Jacob, let's start with you. Can you go ahead and introduce yourself?
Yes, good afternoon, everyone. My name is Jacob Sheridan, co-founder and CEO of TPA Stream. Thanks so much for joining us today. For those of you that might not be as familiar with TPA Stream, we are a software company. We're based in Cleveland, Ohio, and we're focused on collecting claims data and providing claims integrations for third-party administrators and health insurance brokers. And we're super excited to talk about how we're helping small to medium-sized businesses figure out what benefits make the most sense, leveraging data and using our new software called Beacon. Next, we'll introduce Derek. Why don't you share a little bit about yourself?
Sure. Hi, I'm Derek. I'm also located in the Northeast Ohio area, right out of Akron. That's where our company headquarters is. And I've been in the healthcare industry for over a decade on this side of things, and I'm excited to share with you guys a little bit today about Trifecta Health Solutions and also our strategic partnership with TPA Stream that's been growing. And Trifecta Health Solutions, also a software company that helps self-funded employers make sense of their data and see key strategic financial levers and initiatives they can launch to drive down costs. So really excited to be here, and thanks for having me.
Awesome. Yeah, so Derek, now you've been in the business for a little while. TPA Stream initially started as a concept back in 2014, so we've been in this industry since then. Can you just share a little bit more about kind of your background in the employee benefits industry as a whole?
Sure, absolutely. Yeah, as I said, I've been in the industry for over a decade. I had a really brief stint on the PNC side that only lasted a few months, and then I realized the healthcare side was by and far and large the more interesting side of the equation, being employer's second or third largest expense, the premiums being dramatically higher, and it just seeming to be a problem child for organizations. And so our firm based in Akron, Ohio, David Rine Insurance Select Group Benefits, was in business for a number of years, and eventually sold to One Digital. But in that time, we managed groups of all different sizes, small, mid-sized, larger self-funded groups. And the problem was the same for all the groups, in that they had a really difficult time gaining access to their data to use that as leverage to help control the narrative and keep their costs down. And advisors alike also had that same challenge, as I was an advisor having that challenge. And I was fortunate enough in my time as an advisor that I got connected with some of the top independent minds in the country. Joined a mastermind group called the Next Gen Benefits Mastermind Group, and that really took my career on an accelerated path where before other advisors were, I was taking a more data-driven approach to healthcare and helping groups transition into the self-funded arena. And doing everything that I could to collect that data manually before we had technologies, before TPA Stream and Trifecta Health Solutions to solve that. But it was a constant battle all the time. And as I was beginning to implement next gen strategies for some of these groups years in advance of a lot of other firms, and having wonderful success, driving down costs by 20–30% for a lot of my clients, I realized that it was so manual and it was so cumbersome on me that my bandwidth and ability to manage these groups was extremely limited because I was spending so much time on each group. And I could also see why more advisors weren't implementing next gen strategies, because how do you streamline that without having sophisticated tech to help you manage that process? Both of which obviously we're going to talk about how our technologies help here with that today. But that's ultimately what led me to create Trifecta Health Solutions, which is really a technology solution where employers can lean on us to extract their data from TPAs and carriers and be able to see right there in one data command center what the opportunity is across the board for implementing a number of next-gen strategies that are going to lead to quantifiable, measurable cost reduction. And so, and we have some other neat things in there too, like AI. We actually have an AI solution that enables us to take historical claims data and predict future events for financial forecasting and early interventions. But I'm also very excited to share with you a little bit today about the success that we saw have doing some pilots with TPA Stream and what that transition looks like from being a smaller mid-sized group and be able to finally gain access to your data and have that type of leverage, which I never had as an advisor during my time, David Rine Select Group Benefits. And so very, very excited about that. And then what that transition obviously looks like for that self-funded employer to continue down the path and maintain control of costs.
So Derek, let's talk about that a little bit more, right? So self-funding. Self-funding is something that historically has only been talked about with large groups. However, that's changing. Can you talk to why, we're seeing employers, smaller and smaller and smaller, looking at these different types of options, and what market dynamics you're seeing that's just driving them there faster than ever before?
Yeah, absolutely. Two things I would say. The first one is the Affordable Care Act kind of started something where employers, if they weren't self-funded, they were going to have to open up a whole new can of worms on their rating system, obviously, age, geographic location, gender, tobacco use, that composite rating. So a lot of level funded plans and different mid-sized groups getting into self-funded strategies was a direct result of the Affordable Care Act. But with that being said, the market is migrating toward a data-driven approach in general, where fully insured employers are realizing I have no transparency, zero transparency. And even though they may not get full transparency moving over into something like a level funded plan, they are gaining some transparency with their data where they can at least see loss ratio data and have a chance to win, even though they're not able to put in some of the key strategic things that the larger groups can to continually drive down costs. But then you have mid-sized groups that when you get just a little bit larger in the 50 employee plus up to about 500 employees, they're starting to self-insure also in level funded, but also into mechanisms like group captives. You're seeing a huge migration in that direction. And what's preventing other employers from not making the transition into those types of vehicles is the fact that they're so scared of what the outcome could be because they don't have access to their data yet. And they don't know that a solution like a TPA Stream exists where they can finally see that data, see what specific components are driving their loss ratio, what their loss ratio actually is. Because as an advisor, I was told by the insurance carriers over and over again, well, groups under 100, we have no transparency. We can't tell you the loss ratio. All we can tell you is you were fairly sick this year, and here, enjoy your 35% freaking increase. I mean, that's what we were facing.
Well, so let's talk about that. Yeah, I mean,
yeah.
So one of the reasons why we're having this webinar is just talk about a case. 36% savings, not to jump to the punchline, but yeah, why don't you share a little bit about this case?
Yeah, absolutely. So at any rate, one of our clients in our block of business and family friend approached me and said, hey, look, we're up against a significant increase this year to the tune of about 36%, and we have nowhere to go. We've already gone through and completed these electronic health applications that are supposed to give underwriters from other carriers the opportunity to bid on us and provide lower rates than our incumbent carrier who assessed the increase. And for those of you who don't know, many of you do, that's the standard way to put a group out to market, is to shop it through those electronic applications and see if anybody bids because they like the risk and comes down and undercuts the rate increase. And so after that process, that had taken place, the employer realized that they had nowhere to go because there were no competitive bids based on this data. And so, as a friend, I took a look at the data and saw that there were a couple high-risk individuals, but there was no way for us to possibly know if these high-risk individuals, the actual claims they were incurring, were driving a significant loss ratio, or if this carrier was just kind of BSing, if you will, and using that high-risk profile to justify giving this employer a 36% increase so that they could just continually profiting off the group at an exponential rate. And so with nowhere to go, we learning about the TPA stream solution and wanting to do a pilot, we were able then to, for the first time ever, extract EOB data on everybody in the group individually and aggregate that data together through the TPA stream solution. And we found that the loss ratio for this group was only like, I forget what it was exactly, like 40%. And so the carrier's sob story about these high claimants that were this major risk for them, we realized that they were profiting substantially off the group. We had the data for the first time to leverage that. And as a result, we were actually able to get the entire increase eliminated. 0%, is it 36% to a 0% increase is a result of having that leverage. And so I was able to see firsthand the power of TPA stream, which then ultimately led to have more conversations with Jacob and his team, because what we're doing on the flip side of that with Trifecta is that type of group would have never had the transparency to go self-funded. Well, now that group, knowing what their loss ratio is and what the prognosis is, actually can have confidence transitioning to self-funding, which then becomes the perfect marriage for the Trifecta solution, where we can help control costs. So the kind of the perfect 1-2 punch there, but I mean, we were just enamored with the results of TPA stream and realized there's nothing like it. It's the only way to truly give the employer at that specific group size of under 100 transparency with their data.
Well, in talking to other brokers in the market, I had a call earlier today, just talking about the visibility of what this does, right? So not only helping to kind of reduce the renewal increase, right, or make the business case, or to start evaluating other types of options besides fully insured, but also a huge opportunity to look at alternatives, right? Really dive into RX, look at, if any patient assistance programs might make sense, copay assistance, international sourcing opportunities, right? I know you have a slew of partners that you work with on that side of the house. Other types of education and programs based on their usage of emergency rooms, right? And other types of facility-based care. I don't know if you want to talk, a little bit more maybe about kind of how you look at groups kind of after you get through this analysis and what you're able to do, and maybe can kind of blend in some of the strategies that you guys implement during the year through Trifecta.
Yeah, we really tried to take I mean, obviously that's what our company was founded on, but even prior to that, as an advisor, we tried to take a data-driven approach to everything, and gaining that transparency with the data is absolutely step number one. You can't do anything without transparency. But then from there, we kind of took a supply chain management approach, where we would look at all the different components of the healthcare plan, from the pharmacy to the imaging to the surgeries, to the network and discounts, second opinions, on and on and on, all different things that we're able to identify in the Trifecta Command Center solution, and actually identify specific areas for each of those things I just mentioned on how you can drive down costs. Can you source this medication more effectively and lower the cost by 50% via international sourcing or a patient assistance program? Can you get this MRI done in a facility down the street that would have saved 80% on the cost of the MRI, or a direct contract with a surgery? Or should you have gotten a second opinion for this upcoming brain surgery? Or why do you have 46 people that are 65 plus on the plan when they could be getting a better deal through a Medicare Advantage package and evacuate that risk? All those type and many more, but all those types of things are things that we look for an employer from a supply chain management approach. And without getting the data, there's no way for an employer to be able to make those strategic decisions with their advisor that we're able to showcase in the Trifecta Command Center. And there's no way to even get to the Trifecta Command Center for a mid-sized group unless you initiate with the TPA stream to have the confidence to go self-funded. So as we look at this package as a whole, and one of the reasons we're doing this webinar today, Jacob and I have talked about, is this is a start to finish solution here. This is a multi-year plan where an employer and advisor can look and say, wow, I can put together now a 3 to 5 year plan for my clients with confidence, where I can work for the first year or two on getting their data and access. And then from there, I'm going to have the variables in front of me to be able to manage in a technology solution that shows me what initiatives we need to launch now for the next several years to control costs.
It's great, and it's really exciting. I mean, there's nothing like helping these businesses that need more help than larger businesses, right? Save money, and there's more opportunity now than ever before. You know, when evaluating different options, you know, especially for those fully insured groups, I mean, there's so many variations right now where small businesses are able to take on risk. Do you want to maybe just talk to some of the variations that you've been, you know, recommending, advising, and maybe any new ones that you've been hearing about that are more popular this year and into this open enrollment?
You're talking about as far as the funding strategies, correct?
Correct.
Yep, absolutely. So as far as funding strategies go, I mean, you have obviously small employers that are really high risk, not having the confidence to go self-funding. A lot of them end up migrating into the ACA pool, which is sad. But I mean, that's a pool that there's no underwriting, and the reason they go into that pool is at least they know that the carrier rates are geographically based and based on those factors, and they're not going to get creamed on their loss ratio year after year because they have no transparency of their data. But you have level funded approach. You have multiple employer welfare plans. A lot of those are self-funded. You're going to have your group captives, obviously, which for mid-sized groups from 50 to 500. You're going to have unbundled level funded plans, which are level funded plans that employers are actually custom putting together that are act and walk and talk more like a captive than they do as a traditional bundled level funded plan. And then you're going to have traditional self-funding and stop loss, and a lot of different variations on that as well. You have employers that are going to have specific and aggregate coverage, employers that are a little bit larger that are going to be taking a little more risk. It's usually segmented based on group size and industry and their appetite for risk. But those are the primary funding strategies. And for the types of groups that are a really good fit, obviously, for your solution to implement that, those are primarily groups that you're going to see in the I would say, in the you know, 10 life group range versus where level funding starts to up into the several hundred employee group range, where they may get some limited access to data, but they're not going to get the full transparency unless they put in a TPA stream type solution. And then obviously the larger groups are getting access to their data now, the ones with several hundred employers and larger. However, you know, they don't know what to do with the data. And a lot of times their advisor is doing nothing more than slapping on a wellness plan and saying the network discounts are really good and letting the thing run.
Right. And, you know, in thinking about kind of all those different funding strategies, and even kind of your kind of farthest on one end, the self-funded plan with stop loss, I think the perception is that that's more risky for these businesses. But
Yep.
from your perspective and the plans that you've designed in the past, are you able to create a risk profile that's essentially at the same level as a fully insured plan, if not lower?
Yeah, no, that's a great question. I absolutely, in my opinion, there's greater risk for an employer financially to stay fully insured than there is to migrate to one of these newer plans if the right parameters are in place. It's way too risky not to have access to your data. When you're looking at compound rate increases of 10, 15, 20% based on your risk profile. I mean, it's greatly outpacing inflation or any other area of your business, greatly outpacing wage increases you can give your employees. You're handcuffing yourself. I mean, the risk of maintaining the status quo and staying fully insured is way greater than making the jump to self-funding, even if you get hurt for a couple of years in self-funding while you're roping in your costs. If it's done right, you really can't get hurt, because if it's done right, you can set your aggregate factors, which is a term I won't go too far into, but you can set it so that your worst case scenario is about the same or only a little bit worse than what you would have done fully insured anyways. So if you have the right advisor, then you can make the transition to self-funding without getting creamed like many employers think you would.
Fantastic. Yeah, no, I just like educating like the market, right? I think small businesses don't know any better. And I think we need to talk more about the other options out there. So I appreciate you sharing this. I think everything that we've been talking so far about has been awesome. And let's move to talking just about if for anyone listening in today, if you like what you're hearing and curious as to like how you could leverage these solutions, let's talk about that for a minute. So, and I'll just start kind of on the Beacon side, and then I'll move it over to you. But so TPA Stream, right? We're a software company. We've kind of released this new product called Beacon. We've been testing out the software, and we've had a number of groups go through already, and we're starting a full release in October. So we're super excited to let anyone start using the platform. We have a very long waiting list that we'll be reaching out to. If you're on that list, you will be getting an email from us very soon, and you will be able to sign up starting in the first week of October. It takes less than 30 days for the data to be collected by Beacon. It can take as little as a few days, but typically does take a few weeks, unless you do get everyone to enroll very quickly. We are rolling it out with the intention of many brokers and advisors leveraging it for this open enrollment, because of the speed at which we can get this data. Even if you're currently in an evaluation process with groups, if you had groups fill out forms, you're still able to leverage this data. And sometimes it might make sense to use it, sometimes it might not, but at least you're going to have the data to be a more informed advisor and provide more of a data-driven approach, which it just seems like the market's moving in that direction. I don't know, Derek, if you want to share more about kind of just the direction that you're seeing the market going in, and how different advisors are differentiating themselves. But then also would love to hear about how brokers and advisors could take advantage of your command center as well after kind of groups are on their kind of new plan where maybe they're taking on a little bit of risk, which I believe is kind of where you really focus, right?
Yep. I think you're 100% accurate in stating that the market is headed toward a more data-driven approach. And I really think that's for two reasons. That's for legal reasons, is a result of ERISA being enforced more stringently, and then also as a result of the Consolidated Appropriations Coming Act, where there's actually more liability for employers there needing to partner with an advisor or TPA or a partner of some sort that can help them navigate that. It's that act is almost enforcing employers to, for the first time ever, say, okay, we for the first time ever have a legal reason to come to you outside of ERISA that says that we need unfettered access to our data, otherwise we can't comply. And so it's a major opportunity that employers and advisors should be using to gain that unfettered access to their data. And that's where our technology solutions obviously come into play to help with that. But advisors who are winning business right now and outpacing the rest of the industry and the broker world, they are taking a data-driven approach. The ones that aren't are going to be left in the dust. They're using a myriad of different analytics and things like that, taking a data-driven approach towards more next-gen strategies, and are migrating their groups into self-funded type plans. And they're just getting more creative. And so if you're an advisor not doing that, you have an opportunity today to have a lot of that process automated for you between TPA Stream and also the Trifecta Command Center, in that these technology solutions are going to tell you what to do with the data and how to make informed decisions with your group, and we'll even help advise you on that. But yeah, that's definitely where the market's heading. I just was reading that Milliman stating that the average family cost of healthcare for a family of 4 is now over $30,000 projected for 2022, which is absurd. And so, I mean, that's a lot of people's salary, and that's the average cost of healthcare now for a family of 4. So if you're not taking a data-driven approach now to healthcare with numbers like that, then your groups just can't win, and healthcare just becomes an unaffordable cost. And we know that it can be an affordable cost. It just requires data transparency is step number 1.
Could not agree more. Well, no, this has been great. Let's see here. So it's 1:26. We've scheduled the webinar for another 4 minutes. Amanda, do we have any questions, or we can maybe open it up for Q&A? If anyone has questions, feel free to drop it in the Q&A section. I'm happy to answer them for any of the attendees.
Yeah, we have one question here. What kind of groups do you find these solutions most valuable for? Do you have segments of the market that these solutions really shine?
Yeah, happy to take
Derek.
that, or Jacob. I would say for our solution, Trifecta, we're primarily for groups. We'll work with groups of any size as long as they're able to gain access to their data through their TPA or carrier, which is primarily self-funded groups in either captives or traditional self-funding, some unbundled level funded plans. But traditionally, groups with 50 or more employees are the types of groups that are in those types of funding solutions that they can gain access, and we can help if they're self-funded. And obviously for Jacob's solution, I'll let him talk to that, but it's a slightly smaller market segment.
So it's been interesting. We've initially designed it for the small to medium-sized business segment. However, there's been interest for larger groups more so than we ever thought. And so it's really one employee, right? One employee or more can leverage the tool and work with their advisor and broker to take a data-driven approach at advising them and helping them figure out what's the most appropriate and best value benefit package that they should be taking advantage of.
Great. So we have another question here for just wondering what Trifecta does. Derek, can you just provide us a little bit more of a overview for those that might have joined a few minutes late?
Yeah, sure. Trifecta is a data command center. It's an analytics software program that takes data on behalf of an employer through the carrier or TPA. And we're able to show the advisor and the employer what strategic initiatives they should launch on a number of different areas where they can save costs that will, down to the penny of what we're analyzing in our system, show them quantifiable, measurable savings. So areas like pharmacy, surgeries, diagnostic testing, second opinions, Medicare initiatives, on-site clinics, telemedicine, on and on and on. All different areas where we're taking that claims data into the Trifecta Command Center and showing what the precise cost reduction opportunity would be to launch those initiatives and help advise in what capacity those initiatives be launched. And then the second component to it is that we actually use AI to kind of predict where the costs are going based on the employer's historical data. So that's kind of what the Command Center does in a nutshell. It's kind of a key strategic quarterback machine for an advisor where they can come and have scenarios run within an analytics system to show what they should be presenting to their clients.
Great. Another question, and I realize we're at time, so if you have to drop, thank you for joining us. We'll send the recording after the fact and follow up with you. We have another question here from someone wondering what PHI releases are required by employees, if any.
Yes. So in order to collect this data, right, we do need the release. The individual does agree to our terms of use and agrees to all of our legal to give us the ability to collect this data on their behalf and then share that data with named third parties. We do require the individual to go through that process, but after they do go through it, then the advisors and brokers are able to leverage that data. We do have a couple different options. We have customers that leverage that data for a limited period of time, typically over a quarter. We also have other customers that leverage that data on an annual basis. We kind of support those two different approaches. Is
Great.
that it, Amanda? Should we wrap up?
Yeah, let's go ahead and wrap up. Thank you so much for joining us. If we didn't get to your question, we'll make sure that we get that answered via email follow-up. Thank you so much to both of our panelists, Derek and Jacob, for your time today. It's always fun to chat where the industry is going. And I know that I'm certain that our attendees enjoyed listening to your thoughts on that. Really appreciate it. I hope everybody has a wonderful day.
Thanks, everyone.
Thanks.
Take care.
Bye now.